Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. The topic is psychosocial integrity. A patient diagnosed with an anxiety disorder is prescribed a benzodiazepine. When teaching the patient about the medication, which of the following information would the healthcare provider include? Option A. Decreasing your daily caffeine intake is not necessary when taking this medication. Option B. You should avoid taking aspirin while you are taking this medication. Option C. It's important that you discontinue this medication if you begin to feel drowsy. Option D. Call our office right away if you experience increased restlessness or agitation. Right answer is Option D. Call our office right away if you experience increased restlessness or agitation. Benzodiazepines increase the effects of GABA. GABA, gamma-aminobutyric acid, is the major inhibitory neurotransmitter in the central nervous system. Decreased anxiety and a feeling of drowsiness are expected effects of benzodiazepines. Patients should be advised of a possible paradoxical reaction of restlessness or agitation. The healthcare provider is caring for a patient who has undergone electroconvulsive therapy, ECT. The patient should be carefully assessed for which of the following common adverse effects of this treatment? Option A. Aggression and violent behavior. Option B. Headache and memory loss. Option C. Palpitations and cardiac arrest. Option D. Dizziness and blurred vision. Right answer is Option B. Headache and memory loss. ECT is a procedure performed under general anesthesia in which small electric currents are passed through the brain. ECT induces a seizure, which can cause transient increases in blood pressure, pulse, and intracranial pressure. The most common adverse effects a patient may experience after ECT include headache, confusion, and memory loss. When planning care for a patient diagnosed with Alzheimer's disease, AD, which of these interventions is most therapeutic? Option A. Speaking in a loud, clear voice when talking to the patient. Option B. Giving the patient several directions at a time to improve memory. Option C. Encouraging both verbal and non-verbal communication. Option D. Providing immediate feedback by correcting errors in the patient's speech. Right answer is Option C. Encouraging both verbal and non-verbal communication. As the ability to communicate verbally declines, non-verbal communication may become more prominent. Encouraging both can facilitate communication and decrease frustration. Speaking clearly and calmly is effective, but increasing the volume of the voice is not effective and can increase the patient's anxiety. Giving several directions at a time is useless and frustrating for the patient. You are taking the history of a 14-year-old girl who has a BMI of 18. The girl reports inability to eat, induced vomiting and severe constipation. Which of the following would you most likely suspect? Option A. Multiple sclerosis. Option B. Systemic sclerosis. Option C. Bulimia nervosa. Option D. Anorexia nervosa. Right answer is Option D. Anorexia nervosa. All of the clinical signs and symptoms point to a condition of anorexia nervosa. The key feature of anorexia nervosa is self-imposed starvation, resulting from a distorted body image and an intense, irrational fear of gaining weight, even when the patient is emaciated. Anorexia nervosa may include refusal to eat accompanied by compulsive exercising, self-induced vomiting, or laxative or diuretic abuse. On the 5th day postpartum, a woman calls her healthcare provider and reports pronounced fatigue, sadness and tearfulness. She states, "I feel so overwhelmed, I don't know what to do." Which of the following questions is most appropriate for the healthcare provider to ask? Option A. How much sleep do you get in a 24-hour period? Option B. Is there a friend or relative that come and help you care for your baby? Option C. Do you blame yourself for not being able to cope with motherhood? Option D. Do you ever think about harming yourself or your baby? Right answer is option D. Do you ever think about harming yourself or your baby? Feelings of fatigue, sadness, and tearfulness can be common symptoms experienced in the postpartum period. Both postpartum blues and postpartum depression share similar symptoms, including sadness, crying spells, mood swings, irritability, and insomnia. However, patients who are diagnosed with postpartum depression may experience more severe symptoms, including thoughts of harming themselves or the infant. When administering medication to an inpatient with paranoid schizophrenia, which is the best method? Option A. Wait until the patient seems calm. Option B. Leave the patient's door open. Option C. 2 nurses should be present. Option D. Show trust by closing the door. Right answer is option B. Leave the patient's door open. When working in mental health settings, patient and staff safety come first. The patient's door should remain open, except for an invasive procedure, which requires a second staff member as witness and chaperone. Medications are given by schedule, not patient behavior. A nurse should never look elsewhere or turn away from a patient, especially if the patient has a diagnosis that includes possible angry or violent behavior. What behaviors can be expected with a new patient who has been diagnosed with disorganized schizophrenia? Option A. Stupor or presence of waxy flexibility. Option B. Suspiciousness toward others and auditory disturbances. Option C. No prominent symptoms or emotional expression. Option D. Social withdrawal and nonsensical speech. Right answer is option D. Social withdrawal and nonsensical speech. Disorganized schizophrenia is characterized by regressive behavior with social withdrawal, odd mannerisms, and nonsensical speech, including making up words. Absence of prominent symptoms and little or no emotional expression are characteristic of residual-type schizophrenia. Stupor, no psychomotor activity, and presence of waxy flexibility, maintaining a position until moved by another person, are indicative of catatonic schizophrenia. A 9-year-old girl with a diagnosis of attention deficit hyperactivity disorder, ADHD, is starting on methylphenidate, Ritalin. What will the pediatric nurse assess during follow-up appointments? Option A. Acetone in urine. Option B. Vital sign trends. Option C. Deep tendon reflexes. Option D. Height and weight. Right answer is option D. Height and weight. A possible adverse effect of stimulants such as Ritalin, Adderall, and concertized slowing of growth. A 2013 study found that by adulthood, most ADHD children who received medication had achieved normal height. However, growth is still monitored during medication therapy. A patient presents to the clinic with a report of fatigue and difficulty concentrating. Which additional statement made by the patient would alert the healthcare provider to possible marijuana use? Option A. I feel anxious and have trouble sleeping. Option B. I'm nauseous and don't feel like eating. Option C. I've noticed that my eyes are red lately. Option D. I keep having really vivid and scary nightmares. Right answer is option C. I've noticed that my eyes are red lately. Marijuana use can cause corneal vasodilation and conjunctivitis. THC, tetrahydrocannabinol, the active ingredient in marijuana, affects thinking, memory, appetite, and coordination. It's more likely that marijuana would increase appetite, decrease anxiety, and promote sleep. A patient who overdosed on oxycodone is given naloxone. When assessing the patient, The healthcare provider would anticipate which of these clinical manifestations of opioid withdrawal. Option A. Irritability and nausea. Option B. Depressed respirations and somnolence. Option C. Hypothermia and euphoria. Option D. Bradycardia and hypothermia. Right answer is Option A. Irritability and nausea. Naloxone, an opioid antagonist, will displace opioids at the opioid receptor site. The healthcare provider would expect to observe irritability and nausea. Heart rate and blood pressure will be baseline or elevated, and temperature will be unchanged. Depressed respirations and somnolence are signs of opioid intoxication. Thanks for watching. If you like our video, then do like, comment, share. Subscribe our channel for regular updates.